Again, my name is Scott Arseneaux. I'm a Supervisory Special Agent for the Drug Enforcement Administration. Today I'm going to be talking to you all a little bit about the opioid epidemic and some of the signs of addiction. That's what I'm here to talk about today. I'm going to start with a video, and I usually have it ready to go, and I got to find Miss Katie. There she is. So the title of it is The New Face of Addiction. This is about 2016, and it's a very, you got to really listen to it because there's a lot of points in this that I'm going to bring up and refer to.
The new young face of fentanyl addiction, before and after. 22-year-old Katie Mather, forehead and chin clawed open by her own fingernails because the use of fentanyl makes her skin crawl. I spot her on the Strip, Surrey's infamous drug hangout, and ask if she'll talk to me. She puts cover-up on her raw skin.
So I'm literally just did my mascara and I'm good to go.
Katie settles in to tell her story.
There you go. Perfect.
How she ended up living on the street 3 months ago, addicted to fentanyl.
Well, I've been using, it's actually funny, well not funny, it's terrible. I have a really addictive personality. I've always been like addicted to something, whether it was shopping or Facebook or whatever. And I did an oxy, I got addicted right away. And then I found a regular dealer and I started picking up all the time. I remember the day the fentanyl came out and my dealer said, you know, I've got these new pills, they're fake oxys. He didn't tell me they were fentanyl because nobody knew what fentanyl was yet. He just said they're 100 times stronger and they're only $5 more. And I was just like, okay, because I was getting a pretty high tolerance at this point.
Oxys, OxyContin, led to fake 80s, fentanyl posing as OxyContin. Immediately, Katie wanted nothing else.
I could buy one of these fake 80s, put them into 4 lines, and 2 lines would last me a full day. That's how strong it was. And if I did a full pill, I would OD.
Katie says she's overdosed 11 times, most recently a few days ago. Brought back by paramedics or friends on the Strip who have naloxone, the powerful opioid antidote.
Every time I do dope, I know I'm taking a risk. I know that I might die, but like, it doesn't matter how many times I've OD'd, I still use the next day because the withdrawals are so bad.
Katie has been in the news before. She and her sister attacked by a Rottweiler cross back in December. Katie was badly hurt and spent time in hospital. She says that cemented her addiction to fentanyl. As she talks, blood starts to seep through her makeup.
Katie, you're 22. Why would you risk this?
Well, at first it was just fun, right? It was just for fun. It was just a party drug that, and there's been some things that I've gone through and it helped with a lot of pain. And especially after, that dog attack, I just couldn't stop,
I asked Katie if she worries about herself and her future.
Sometimes. I don't know. I just like to take things one day at a time, right? I'll kind of just go with it and hopefully, hope for the best.
For now, the best Katie can hope for is to wake up from her next fix of fentanyl. Eric Rankin, CBC News, Surrey.
So that's the legal disclaimer. Today, I'm not getting paid. I don't want to get paid. I'm doing this because I think it's important and my agency wants me to. We're big on pushing the community outreach and speaking to the regulatory individuals. These are the objectives I talked about. A little bit of definitions. We're not worried about the definitions. You know them. Those are numbers, 47, 14, as you go along. 2017, it went up. I will tell you about 2018 a little bit. It's actually going down for the first time in years. So that's why I am personally optimistic, our agency and everybody in this room should be optimistic that we are making the right decisions. That's about how many people we estimate would have died this year, except it goes down, fit the Superdome. Somebody originally gave me this slide and it was the Mercedes Dome in Atlanta. I said, there's no way I'm putting that on this screen. No way. Each city does things differently. So I said, no, I'm going to put, I tried to put Tiger Stadium, but that's 101,000, and I didn't want to do that. So again, the Northeast, you see where most of the overdose-related deaths, and that is, again, because a lot of the opioids from China are coming in through Canada and then dropping in this way, and that's where a lot of the deaths are. One thing that Louisiana is not leading in is opioid deaths. We're not even in the top 5. We are in the top half of concern, but we are not even in the top 5 of opioid overdose deaths. It's good. I've been to several symposiums, and I'm very excited about what this state has done. All right, so this is one of our problems that law enforcement is dealing with. Prescription painkillers with fentanyl included in them. As you heard from Katie, she had an oxy, didn't know fentanyl was in it. Well, that's what they're doing. They're giving pills that way on the street. They're saying, hey, you want oxy? Here you go. And the thing is, people are getting high, getting really euphoric, so they want more. And there's fentanyl in it. Problem is, fentanyl will cause overdoses. And I'll get a little more into that because that's very important. These are what you're seeing. Pharmaceutical, hydrocodone, heroin. Doesn't look like much of a pill, but they're selling it in pills, and people feel safer taking pills than shooting up like it was in the 80s with heroin. So now everything's in pill form. 10 most commonly filled substances in the US, 18, you see them. Hydrocodone, oxycodone, all those are listed. Dextroamphetamine was for narcolepsy, I believe. But you look at that list, 10 most commonly filled controlled prescriptions. 2 of those, oxycodone and hydrocodone, are in most overdose deaths. Okay, which that's what they're being prescribed. I'm not saying not to prescribe them, but that's what's happening. Methadone. The overdose amounts are high because people go to methadone clinics, get on methadone to beat the habit, and they don't beat the habit and go take more of meth, oxy or hydro, or even fentanyl, heroin, and they die. That's why methadone's in their system. Methadone is prescribed less now for a pain reliever, more as an addiction, to help addiction. Yes. And of course, they use methadone because when your addiction is higher, you gotta have methadone. Buprenorphine is for lower doses because there's a different ceiling for it. Fentanyl. I'm going to get away from the pictures because it's going to be interesting why I explain these pictures. Fentanyl, Schedule II synthetic, pain reliever, onset short duration. Approximately 30 fentanyl-related substances. You got the carfentanyls and the fentanyls, and there's a whole bunch of fentanyl type of substances, and they're each getting worse. And they're trying to make a different product that makes you feel higher, better. Fentanyl, pill form, powder form, liquid form. So it's very hard to decide in law enforcement what I'm looking for because it can be shipped many different ways. I know how cocaine's shipped, all right? I know how marijuana's shipped. These are tougher. That's why it's harder. That's why we're having problems with fentanyl, but we're going to get to the bottom of it eventually. You see what that is right here? With the M? Oxycodone? What's that? That's Pez. It's not Pez, it's fentanyl. It's fentanyl. Now that should make you understand what the problem is. All right? I just added this slide because the next slide is when you see that it's not in one form. They put it in anything. Pill press. Yes. We'll talk that about a little bit too also. Very good. Prince. This is fentanyl. Watson 385, isn't that acetaminophen and hydrocodone mix? No, that was fentanyl. So mislabeled as fentanyl, sitting in a lead bottle. Now, did he know he was taking fentanyl? Maybe. That's probably how it was given to him. But that's what they're doing. So if I pull up on somebody, if I was a traffic cop and pull up somebody and I see, oh, he's got to leave. He's got hydrocodone acetaminophen. There's nothing wrong with that. It's fentanyl. That's what the problem is right now. Why? It's cheaper to make, and I'll get to that in a second also. Easier to transport because you transport less for a higher dollar value because it's much stronger. 100 times stronger than morphine. Harder to detect by law enforcement because we don't know what substance it's in. Much larger profit, and you will be amazed at the profit when I show you in a second, and sold through anonymous transactions, a lot of online stuff. Here's the telltale sign. 1 kilogram of fentanyl. You typically don't want more than 1.25 milligrams per pill, and there's a reason for that. So $10 a pill, 1.5 milligrams for a kilo, you make 600,000 pills. $10 pill, you do the math, $6 million for 1 kilo. 1 kilo. A kilogram of fentanyl is about 1/10 1/8 the price of a kilo of cocaine. It's very easy to make. The reason that it's so profitable, China has thousands of manufacturing chemical companies that can make fentanyl. Fentanyl is made from chemistry. It's a chemical compound. You don't need an agricultural addition to it like you make heroin. So it's very easy to make, and it's very cheap to make, and there's no regulation in China. Sure, they say they're in agreements with the US. They are not. There's thousands of companies that can make fentanyl. And if you make the profit that's right there, who cares who dies? I have had a case recently where the dealer was selling fentanyl-laced pills. He would promote overdose deaths and overdoses. My stuff is good, you see? And they don't care about death. He promoted overdoses. I was blown away. I'm like, really? It worked. Overdose deaths, we're not going to worry about that one. We're going to talk about that in a little bit. You can see how many pills you can make. So this is what's also going to be important, but I want to go over one other little thing with you. Just recently, before I do all these presentations, it seems like days before something new comes out. This week, it came out, DA did a case, and they had an individual who was found with fentanyl. He was a chemist. He was an ex-Navy specialist, chemist making fentanyl, buying the precursors from China, making it himself. He had over almost 2 kilograms. A lethal dose of fentanyl is 2 milligrams. He had enough fentanyl to make over 1 million lethal doses. The thing that scares me, he also was making it and putting it in vaping products. Let that sink in, because we know vaping is becoming an issue. We have 2 deaths in this state so far. The first one was somebody who I worked with his dad. This is a problem. He said when they got him, I have enough fentanyl to last me 2 lifetimes, me and my wife. Could have killed over 1 million people. That's how bad this is. Reason it's bad, when they press fentanyl, what typically happens, let me go back a little bit, what typically happens is they'll go through the dark web or the internet and they'll order these precursor products, these fentanyls from China. It comes in, the drug dealers go through a certain amount of levels, and it gets to a guy that's going to press pills. What he's going to do is he's going to mix this fentanyl with something else, and I'll go over that in a second. The problem with fentanyl is fentanyl clumps. So when they mix it, you're not getting an even amount per pill. You're trying to get 1.5, maybe 1.25 milligrams, which is the amount they put in when they put you to sleep for surgery. But they try to get no more than 1.5 because it'll kill you. Well, it clumps. So 25, 1/4 of the pills in what that press is made is going to be lethal. And if it's your first time taking it, you die. You will not make it back. It will take you several naloxones if you're lucky. That's one of the problems. They don't know how much fentanyl is going in these pills. We seized hundreds of thousands of pills, and earlier this year they tested a certain amount of them, and 25% had lethal doses in it. So that backs that statistic up. Now, street names. This is important because in your practice, especially if you're in an emergency room, first responder, and you see somebody who is high or overdoses, you typically ask them, what are you on? What are you on? Well, I'm on China White. Well, you know what that is? So these are very important for you to know. But if you look closely, these are all names for fentanyl. Drop dead, flatline, lethal injection. Why would I want to put those in my body? The definition, the title tells you. But be aware, these are things you need to know. From the family side, if you are a parent, you have a teenager or any family member, engage them in communication, conversation. I look at my 14-year-old's phone. He doesn't know that phone, I do. And if any of this comes up, I'm going to ask him. So you need to know about these things. These are just some of the names. Chinatown, China Girl, because, of course, the China connection. Dance Fever, Great Bear, Poison, Percopops, Lollipops. Wow, if you see texts about lollipops, do you think anything about it? But who texts about lollipops? Not many. So if you see it, you may want to think that maybe I want to ask about it. Doesn't mean anything. Maybe I want to go further. Lollipops. They're trying to hide fentanyl. And they will sell it laced, a lollipop laced with fentanyl. These are names you really need to know. What is fentanyl being cut with? So when they get fentanyl from overseas, you don't make a full pill of fentanyl. You know, that'll kill a horse. You put that 1.5 milligrams, maybe 1.25 milligrams in a mixture and make the pills from a pill press. But you need to know about this because let's say you live in a house and one day you went shopping and you got a big bag of flour and the next day you have a half a bag of flour. May not mean anything, but maybe you want to check into it. This is what they're making the pills with. Flour, caffeine, acetaminophen. So be aware that's how they make their pills that they're selling on the street that is killing people. It's going to be 99.5% flour and fentanyl's the rest of it. They're typically also putting heroin in it with it, but that's not important as far as this goes. Symptoms of exposure. This is important because first responders are the ones that get exposed. The other people are taking it, we go respond, ambulance, fire, law enforcement, medical personnel. So you need to know what the effects are. We know them. They're drowsiness, sedated, disoriented, nausea, coughing, kind of looks a little bit like maybe they're sick. But that drowsiness, I mean, that's obvious. It's a morphine product or equivalent. Moments of exposure, slow heartbeat, respiratory, less than 8 breaths a minute, and cardiac arrest. We quite frequently, now law enforcement carries naloxone with them at all times. And because we have several people that have come in contact and overdose. If you're a cop, hopefully you're not addicted to anything and you get just a sliver of this in your nostril, your eyes, breathing area, you're gonna overdose. You don't need that 2.2 milligrams to overdose. You can do 1/10 of that because your body has not built up any resistance. Okay? Very important. We have people that get up, go in and just pick somebody up. A little powder gets on their shirt, they do that, boom, overdose. Happens to cops all the time. Happens to ambulance and fire department all the time. You need to know that. If you see somebody drop down, be prepared to look for these cardiac issues. Single dose, look at minuscule amount. That would kill somebody. 30 grains of salt. 2 milligrams is fatal. 2 milligrams is fatal. Think about that. That's not that much. Carfentanil, I know the lady before us spoke about, we're not seeing a lot of it, but carfentanil is 1,000 times stronger than fentanyl, which is 100 times stronger than morphine, so you do the math. Carfentanil is a an elephant tranquilizer. Imagine that anywhere near your body. They're seen in the Northeast, but that kills the customers too quick, so they don't want to use that too much. But it's out there, and they're trying to find mixtures that will make it weaker. There's another drug out there that's I always bring up because it goes along with those names. It's called gray death, and people are taking that. Why would you take something called gray death? And what they do is it's just a hodgepodge of fentanyl, carfentanil, heroin. It's just a hodgepodge of stuff. That's what's out there. Lethal doses, you can see heroin, less carfentanil, less fentanyl, or the opposite. A sugar packet could kill everybody in this room, quite easily. These are the strengths. Whenever they're talking about strengths about these drugs, they typically compare it to morphine. So heroin 3 times, fentanyl 100 times, carfentanil 10,000 times. As you can see, morphine, heroin, fentanyl, carfentanil through the roof. There's no reason why it wouldn't kill you. Worst case scenario. This is from a hostage rescue in Russia. 2002, Chechens took over hostages because there were some political issues, I guess. There was 800 hostages and about 40 hostage takers. Russian government, Russian special forces could not get in to save the victims, to control the situation. So they decided, we're going to pump into the air system carfentanil. Because it'll knock everybody out. Oh, no, it'll knock everybody out. Well, killed about 150 people, got all 40 of the hostage takers and about, I think, 114 of the hostages. That's what Russia said. There's actually thought that was probably about 300 to 400. Right, bad decision, but that's what this can do. Law enforcement today is worried about a terrorist attack this way, but we're on top of it, and they haven't had any yet, and we're still watching it. This could be the next way they do something. So they had Remy, fentanyl, carfentanil. That was non-car. Those are the fentanyls. So we have a long history of drug abuse. These used to be individual slides. 1804 morphine was distilled. The reason I include this is because I like the 1853. 1853, the hypodermic syringe is invented. The inventor of this, wife, is the first person to die from an overdose from a syringe. Yeah, so I mean, it was early on, but yeah, that was so. Morphine became a big issue with the Civil War. All the soldiers were addicted. So because of that, around the turn of the century, 1898, Bayer invents diacetylmorphine, which is heroin. It was branded as the non-addictive alternative to morphine. Yeah, it was. So everybody started taking it before they realized, yeah, it's addictive. So then a whole bunch of rules and laws came into play. We're not going to go on all of them, but all of them were to combat the addiction that they had already caused. There's a nice little Bayer bottle with heroin. You know, who would have thought I could buy heroin and it's not addictive? Well, it killed me, but it's not addictive. So, fast forward to 1980s. 1980. I don't know if anybody's heard of the Porter and Jick letter. This started the problem. Porter and Jick were a doctor and, just a lay person. They sent like a 6-sentence letter to the New England Journal of Medicine. The letter was entitled, Addiction Rare in Patients Treated with Narcotics. That was the title, okay? And that's who they were, but addiction rare in patients treated with narcotics. The problem is, for about the next 20 years, these pharma companies were relating to this letter for about 20 years. Hey, these people said addiction rare in patients treated with narcotics. That's the title. But when you read the letter, part of it says, we conclude that despite widespread use of narcotics drugs in hospitals, the development of addiction is rare in patients with no history of addiction. Well, they kind of leave that out when they promote or PR, market their drugs. Because no, remember, addiction is rare. For about 20 years, they were using this as a marketing scheme. So then we got around 1986. So now we're starting to talk a little bit about pain. Okay, so now we're talking about pain, which is an issue these days. Is there pain or is it legitimate pain? But pain starts becoming an issue. So they're talking about, well, you know what? We have to treat pain. Let's treat pain with these narcotics that are not addictive because the Porter and Jick memo letter said it wasn't addictive. So we're going to treat pain. 1994 years later, therapeutic use of analgesics rarely results in addiction because that's what that letter said. They're still referring to that letter. 1996, OxyContin. So they thought that was going to be non-addictive. We know better. And largely for chronic pain patients. For chronic pain patients. President of American Pain Society urges doctors to treat pain as a vital sign. Then they pass it as the 5th vital sign. Who here believes that's a good idea? Can anybody honestly stand up and say that was good? It is the only vital sign as objective. It's the only vital sign you can get without truly doing an examination. But you can do examinations, and we're getting better at it. Pain is a vital sign. Whew. That hurt. That caused a problem because pain is a vital sign that we can treat with OxyContin, which we know is not addictive because the Porter and Jick memo said it wasn't. 08, those opioid overdoses have surpassed auto fatalities. Today, it's also surpassed gun violence. Why is it a problem? Of course, our country, 5.5% of the world's population. Why is it a problem here? 5.5% of the world's population, yet we take 75% of the prescription medication. The numbers are kind of messed up there, don't you think? So, opioid prescriptions quadrupled up until about 2010 because it wasn't addictive. 2010, enough prescriptions medicate every American 24 hours a day for a month. We have a prescription issue. So supply and demand, not really worried. It comes from China. It goes through local cells and sells to users and their overdoses. Very profitable. No regulatory systems in China. Through bitcoins, MoneyGrams, internet mainly. This is how it gets here. This is a international mail facility, one of, I believe, nine. That is a regular occurrence on a daily basis. How can I find a kilo of fentanyl in that? I can't. I can't do it. That's the problem. Drug dogs, they can only do so much. They can only do so much. So we have a fentanyl problem. Signs of addiction. This is important because you are going to see it as a practitioner and you're going to see it as a family member of somebody. Everybody, typically, the mass majority of the people in society know someone who has an addiction problem. All right? With millions of people addicted, you're going to know somebody. Signs of addiction. This is good for your work and your home and anywhere else you are. The inability to control opioid use. Katie, I still wanted it. I still wanted it. Okay? If you give someone a 7-day prescription for an opioid, which is the max in this state, and they're done in 2 days and they need more, they're probably addicted. Uncontrollable cravings, drowsiness, sleep habits because they're up at all times of night sometimes, weight loss, flu-like symptoms, they're sick, decreased libido, lack of hygiene because they just don't care. Katie cared, she tried to do the makeup, but typically you don't care. This is isolation from family and friends, stealing to continue your habit, coordination, poor decision making. If it's 20 degrees outside and they decide to go out in a bathing suit and go swimming, probably an issue. Mood swings, depression, anxiety attacks. This is what I say. The signs of addiction are personality changes, behavioral changes, changes in appearance. What are the 3 key words that everyone else says? Changes. Social withdrawal, poor performance at work and school, money problems. If you're like me, you have teenagers. First thing they want to do is come home, go straight to their room. They have that isolation. So am I going to see those personality changes? Am I going to see those behavioral changes? I will, because every day they get home from school, son, how was school? All right? Just speak to family and friends. If you think there's an issue, even if there's not, because you also have to worry about peer pressure. You know, I broke up with a girlfriend. But if you don't talk, you won't know, because you need to look for those changes. Okay? That's very important. I can't stress that enough, and we just need to start talking. So what's trending? Good news? Opioid addiction is plateauing. Crisis isn't over, okay? So the numbers are actually going down a little bit. So Blue Cross Blue Shield did some, looked at some data, and things are going down a little bit. Number of drug overdose deaths have began to level off. And this was 2018, when they were talking about 2017, because the numbers started slowing down, and actually in 2018, the numbers went down. The numbers went down. But is that always a good thing? It is, but if you look deeper. 72,000, the end of 2017, 2018, it's looking like 69,000, so you're down. That's good. That's really good. There's reasons for it, but it's going down. Why? Stuff that y'all are doing. Stuff that we're doing in law enforcement too, but stuff that we're all doing. Why? Well, look, prescriptions for hydrocodone's going down. Look at it, going down. Well, that's how they typically start their addiction, with those drugs. A lot of them start their addiction from those drugs. Oxycodone going down, went up for a little while, it's going down. Methadone going down as a prescription. Total going down. So you see the trend. You see the trend. So what's happening by practitioners putting less prescription drugs on the street, typically unnecessary, you're stopping that early addiction, which will make a difference. But what about those people who are already addicted? Buprenorphine, it's treatment of addiction. It's going up. That's a good thing. Treatment programs, DEA's registration 1,700, but there's others that's not DEA approved or DEA certified, which is great. I want as many of them out there as possible. This is what's helping the addict. The prescribing is helping the beginning addict. This is helping the people that who are already addicted. Buprenorphine, of course, you may end up having to do methadone because a lot of people are more addicted, and that's a plateau issue, which I know they spoke about before. DA-registered opioid treatment programs, there's 10 of them in this state, and this is as of earlier this year. I'm hoping there's more, and that's just DEA. I know there are more. I know there are more. I think Applegate is probably involved in that back there. They're trying to help. Everybody is. I'm amazed at all the symposiums and conferences I've gone to where people are starting to make a change. Data wave. Physicians that we certify for addiction specialists. Mr. Amos brought it up. He said there are 63,000, but a lot of them aren't prescribing buprenorphine or methadone. So what are they doing? You get data wave certification to help addicts. Now I'll step back to the law enforcement side. If I look at the numbers of a data wave physician, and they have not prescribed buprenorphine or methadone, and their opioid prescriptions have not gone down, you're getting a call from me. There's a reason for that. Some, look, they're bad cops, there's bad doctors, there's bad everybody somewhere, so please don't take offense to this, but there are some practitioners that get data wave because it's harder for law enforcement to gather the records needed to build a case, because there's a little more privacy issues. Just to let you know, I can still get them. It's just a little harder, but I can do it. You have data wave for a reason, to help people. 99.9% of practitioners are, but some are greedy, some want to do it for ill-gotten reasons. We've got 624 in this state. I just want to say, if you are one, treat the addiction, please. Don't just do status quo. Nationwide efforts that these people are helping, but so is the public. It doesn't just have to be these. I'd like to expand this slide. One of the largest reasons why we are starting to see the numbers go down, because we are starting to hit prescription early. You no longer get a 30-day prescription for a tooth being pulled, okay? So these are the states. It's like 35 of them, which I don't understand. Yeah, California still no special rate. I don't know, they're gonna catch up. But most of them are 7-day supplies. Louisiana, 7-day for initial, 7-day for minors. But and all of them have their limits, and they're really working. That's why the numbers are going down. March 2016, Massachusetts, first state to enact the limit of supply. Why do you think that? That's where all those first worst overdoses came from. So they started in 2016. 35 states have enacted some limits, 7-day supply. Exceptions for the professional judgment of a provider. If you tell us they need it, people should not be in legitimate pain. Help them. I'm never going to say that an opioid there's no room in society for it. Because people need to not be living in serious pain, legitimate pain. Of course, I have a wife that works in cancer treatment programs, so I know cancer treatment people really needs. I don't like to see people at the end of life being in pain. Help them. But if there's a 22-year-old who came in with a toothache, do you really need to give them that much? No. This is another one, what I don't understand. 12 states now require patient notification of opioid risks. Why is it not 50? Why is it not 50? Now, I've looked at the list, and I didn't see Louisiana, but my mom had a surgery last week on her wrist, and they told her the risks. They told her the risks. Should be 50. Everybody should tell their patients the risks of taking opioids. You're not telling them not to take it, you're telling them what the risks are. And that's legislation for, limits. CVS has a great policy now. They are looking from the pharmacy side. They're looking at the prescriptions, making sure that we have another set of eyes, make sure there's not problems. We work with the pharmacies very closely. But if they also can commit fraud and abuse against filling prescriptions, we go after them too, and we talk to them. But it's about being on the same page. It's not about me going after anybody. It's about us being on the same page. CVS, very proactive, very proactive. Walmart and actually a couple of different companies are now having drug disposal powders, chemicals. One of the nationwide efforts is drug take-back. We have 2 national drug take-back days in the country, the end of April, the end of October. We've taken back over 10 million pounds of unwanted prescription drugs in the last 20 years. We're starting to get against the addicts day one, so they cannot become addicted. It's important. Walgreens is stocking Narcan at all its pharmacies. And hopefully y'all have talked a lot about naloxone and the need for, especially in first responders. I would actually consider in a high-risk-ish area to have one at my house. Knowing the risks, that's what we need to be telling the practitioners, need to be telling the pharmacists, need to be telling the patients. Talking about naloxone, who should get it. Walmart, they already have started with their opioid limits, like CVS. They're getting very proactive. They're very active in our drug take-back days. They would love us to be at every one of their stores. We just can't, but they're starting to really get proactive. Because if we can get those unwanted prescriptions out of the medicine cabinets, we can start making a difference. 80% of the people who say they're addicted say they got their drugs initially from family or friends coming from primarily medicine cabinets. Safe drug disposal program. The pharmacies are doing it, and they may be able to take a small amount here and there, where on our drug take-backs this past October, I had somebody came with a bin. It was from a nursing home, but it was literally about 100 pounds of just pills. Got them off the street, gone. You can't tell me that's not saving lives. Step to reduce the opioid addiction, lower them, identify legitimate pain. We know that. There's pain versus legitimate pain. Doctor, my elbow hurts. Please give me some painkillers. Is that legitimate pain? No. No. Limits, alternatives. I personally take ibuprofen 800 for most of my pains. I know I'm trying not to stay out too long because I know it affects other things, but it's not going to get me addicted. But it has helped. Clean the medicine cabinets. Give warnings over a disc. We talked about that. Clean the medicine cabinets. That is what you can do on a personal level. Let me end this with one thing before I open up the questions. The last point I really want to get across. We're talking about making a difference at the first initial level. What about those addicts? We need to make it a point to no longer define addiction as a crime as opposed to define it as a disease. What do we do with diseases? We look for cures. We look for cures, treatments. That's how we addressed the people who are already addicted. So often we talk to addicts who say, I am ashamed that I got addicted. I'm like, there's no shame in it. There is no shame in it. It is a sickness. If we do what we can do to stop the early stages, that's what we'll do to stop the end stages. Hopefully everybody else has already told you this. We don't treat this as a crime. We treat it as a disease, a sickness. Thank y'all for y'all's time. Sorry about the little problem early on my part. Any questions? Please feel free. I know everybody wants to get out of here, but any questions? Thank y'all again. I hope I didn't bore any of y'all.